Well, I'm joined now by Matthew Taylor, Chief Executive of the NHS Confederation. Thank you very much indeed for joining us. Blackpool, the latest NHS trust to declare a critical incident. What are you hearing about how serious this situation is?
So the situation is serious across the whole country. NHS England has declared a level 4 state of incidents for the health service as a whole in relation to COVID. And then we have local trusts declaring a moment of critical incident. Now, what that means will vary from place to place, and it's primarily a way for local NHS leaders to be able to indicate that they are very stretched, that they need all staff who are available to come in to work, and that all resources are going to have to be focused on the things that are most urgent and pressing.
Of course, declaring a critical incident in an NHS trust actually means that you can draw on more resources and more support. What are you hearing about just how short-staffed some hospitals are, and indeed how exhausted some staff are?
Well, we've got a number of things interacting here, haven't we? We have these staff, most of them have been working for 2 years in this very difficult situation. We've now got around kind of 10% staff absence is what I'm hearing, and that most staff absent now is Omicron. So Omicron on its own is the biggest reason for staff absence, bigger than all other reasons added together. And then you've got on top of this, of course, the rising rate of hospitalisation, and the figures we've been reading about in the last few days have been influenced by Christmas, New Year, bank holidays. We're really only going to know what's happening in those underlying trends about the number of people needing hospital care over the next few days. And of course, that comes on top of the fact that we've got 2 years of pent-up demand in the health service, people waiting for operations and appointments, and some of those people getting very sick.
And Mr. Taylor, what more would help the NHS to relieve them of this workforce issue, potentially reducing the isolation period? What would you want to hear from the government when they hold this news conference later today?
So I think there's a number of things that our members would like to be considered. First of all, it is really important that NHS and care staff are prioritised for availability of tests. This test availability is an issue, and unless we can get our health and care staff to work, and of course, if you can do the test, it means that you can return to work slightly earlier. We also think, as happened at an earlier stage in this pandemic, that we need to encourage medical students and trainees to help out on wards. That's something we've done before. We think it's necessary, maybe necessary again. And we need to continue to look at the data in relation to how long the isolation period is. The government reduced it from 10 days to 7 days, not in a sense to allow a higher risk, but because the science showed that if you could do a lateral flow test on day 6 and 7, that was as safe as 10 days isolation. So if the science suggests that you can cut that further, well, that would be good. But of course, the last thing we want is people who are still infected with this virus back in a clinical setting.
Of course, United Lincolnshire Hospitals NHS Trust was the first to declare a major incident. Are you hearing of any others that may be next?
I think there are a few, and we've heard about Blackpool. When a trust declares a critical incident like this, it is an important moment. It's an important signal to local staff, to local people about what they have to do. But I wouldn't want to exaggerate the difference between these incidents and the general position of most parts of the health service right now. So, there is no part of the health service that isn't under immense strain. And that's why it's really important that whether it's public policy in terms of how we manage the situation or the individual responsibility that we show, that we do everything we possibly can over the next few weeks to minimise unnecessary pressure on our health service.
And does this mean that we're going to see non-urgent care cancelled?
I think it's inevitable. That in many parts of the country, this combination of rising hospitalisation rates, rising staff absence, is going to mean that anything that isn't very urgent is going to be put on the back burner. And of course, there's still the issue of the fact that people who've got COVID need to be separated out from other patients because of the infection risk. We are seeing the development of this surge capacity. So this is facilities being set up near hospitals, often in kind of car parks, to create extra beds. And that's welcome. That can help with separating patients out. But the problem is, if you have a shortage of staff, if that's the kind of rate limiting factor, well, you can create extra temporary beds, but if you've got no one to staff them, it doesn't make a huge amount of difference.
OK, Matthew Taylor, Chief Executive of the NHS Confederation, thank you very much indeed for joining us today. Thank you.